Continue with his talk. So I would like to invite Dr. Farha Kazi and Dr. Nilanjan Bhowmik with me on the stage. We are just having a very basic panel on how to start your dysphagia clinic. So nowadays we get a lot of queries, questions like what do you exactly do when you are having a dysphagia clinic, or what do you say, how do you treat these patients? So we were given a time of 10 minutes. So I'm trying to finish in 10 minutes. It's difficult because I don't think you can set up a practice for dysphagia in 10 minutes at all. So both of you, what will be a great scenario for you if you have to start a dysphagia practice per se, specialized practice, or a part of ENT practice?
Ideally, a specialized multidisciplinary practice. Ideally.
Okay.
I think with the advent of group practice now, so it's a very smart idea if you can do a group practice and you pick yourself as a specialist in there.
Okay. So there's a new concept, a new dimension to it, where she's saying that you be a part of a group who are all ENTs, and everyone will have their specialty, and then you can. That's what you mean, right?
Right.
Okay. So now that you have decided how you want to go for it, whether you want to be your clinic as a separate clinic or you want to be a part of a corporate setup, may it be a group practice or a part of a team.
I would probably be happier in a hospital setup. A hospital which has all the disciplines. A lot of dysphagia patients are going to be referred to you from neurology and oncology, both of which patient survival has increased over the last 10 to 15 years. So it would be probably ideal for the patient and logistics both for it to be in a space wherein patients can easily access it. Not all of these patients are mobile or walking, so probably a hospital setup would be a better idea.
Any other?
No, I totally concur with him.
Okay. So what do you think? How do you gauge that with everyone wanting to start a dysphagia clinic? How would you gauge the scope of dysphagia treatment in your practice? I mean, if you're an ENT, how will you gauge that, okay, I have to get this specialization, or I need to get myself trained in dysphagia? How would I mean, you would like to tell people, all the other people, like how would they gauge that yes, their practice for dysphagia is more, or how they can get a support from other people in a team or a group for the practice?
So I think dysphagia per se has been branching out of laryngology. So how laryngology was viewed, say maybe around 15 years ago, wherein having specialized laryngologist was something new because everybody was able to operate on and it developed slow and steady. I think dysphagia is somewhere there wherein it's kind of the new kid in the block lately for the past 5 years. It's very difficult for someone to just take a decision randomly that I want to do laryngology or I want to do deglottology. It's a better idea when you're practicing your general ENT, you see where your inkling lies towards. It's going to be 1/3 of what a general ENT practice would be. Having said that, it's more of a multidisciplinary practice. So you cannot just be saying that I'm a deglottologist and I'm going to get my patients in my OPD when I'm sitting right there. It's a lot of referrals, it's a lot of understanding and popularizing that ENT is also a part of dysphagia, because many a times the direct call goes to your gastro for whatever kind of dysphagia goes in. So it has to be slow and steady. Maybe in next few years, hopefully it will catch up its pace. Having said that, I think it's a individual preference to what they want to do.
Okay. So to conclude that, I would say that if you have an incline towards doing dysphagia or laryngology, that would be the best case scenario. It would be better that you have a corporate setup or a multidisciplinary setup where you can get referrals from a neurologist or a oncologist. That is what the panel concurs with, right? So yes, everyone is on the internet and is an expert. Okay. So people, I have got phone calls that such and such is a patient. Tell me how to treat it. What do you have to say about it?
Dysphagia evaluation is an extremely protocolized evaluation. Phone calls aside, I think even when the patient presents to you in your clinic, you require a substantial amount of time with the patient, understanding from a non-instrumental evaluation right on to your instrumental evaluation and possible treatment plans. So it's a pretty time-consuming and a very invested process. So I really don't think that is an option anyway.
Okay, so what Nilanjan wants to say is it's a very, very dedicated kind of dysphagia practice is a very dedicated practice where you really need to be invested in your patient because if you're with the patients a long time and if you're with the patient for a very long time, you do feel bad for the patient if you're not able to get them out of their phase of not eating or not swallowing. So yes, even if everything is there, you know everything, but we need to get invested in the patient A. B, you need to know what are the protocols for evaluating dysphagia. Right from bedside evaluation, you need to have a proper knowledge about how you're going to treat the patient. So it has to be evidence-based. It has to be I don't see the arrow. Can you? Okay, 1 second. Okay. So it has to be an evidence-based where you are trained properly, unlike you just walk in shots and take a shot. So the practice, dysphagia practice is not that, but you really, really have to get invested and get trained yourself in the evaluating protocols. So we were talking about groups. You should work in group or team. So what do you mean by a group and what do you mean by a team? And what would you prefer to work as a group or as a team?
What exactly are we meaning by a group out here?
So that's exactly what I want to know.
So a multidisciplinary team in an ideal world. So there are two sorts of practice in dysphagia. One is that spokes and wheel practice, wherein probably there is one referring physician, say a neurologist, say a general physician, say a physician, and he refers to you, and then you say that no, there's nothing particularly wrong, and then he goes back to him again. It starts again in a different direction. Okay, maybe refer him to a gastrologist. Rather than that, probably a multidisciplinary team like tumor boards, where they sit, discuss that yes, this is probably the problem. A phoniatrician or a SLP being there, understanding that what kind of therapy this patient might require. I think that would be the dysphagia clinic of the future. That is what we should be aiming at.
Okay. So here, Farha, you want to add anything? So basically group in the sense what I wanted to say is like what Farha said, a group practice where everyone is an individual who is doing their individual practice and if required they'll refer to you. So here in a group there is an individual growth but the efficiency is less because they may or may not refer to anyone. But when it comes to a team, you're working together. So that is what dysphagia practice is about. You have to work together. You cannot have an individual person doing their own work and then referring if required. But you need to be yourself. You need to be together with a team, a neurologist, a gastroenterologist, a swallowing therapist, an ENT. So all of them have to work together as a team. That's what exactly what I meant by group. Pediatricians, yeah.
Lots of people. Yeah.
So ideally, in a corporate world, when they call a team, so they say that the efficiency is very good in a team and efficiency is not good with a group. But the individual progress is better with a group and individual progress is not better with a team, because they are growing together and they're not doing individually. Whereas in the group, that's just an individual growth. So that is what I meant by group versus team. So dysphagia is a team effort. You have to keep all the cards together and you have to play them. So now that we have agreed that we are a team member, so who all will be the part of your team? So you as an otolaryngologist, who else will you make?
So there is a core team that works with you every day, which would be you and your swallowing therapists. So maybe one, maybe two, maybe however, based on the number of patients you have. Beyond the core team would be your group of, or the team of other colleagues who are working with the patients with dysphagia, or patients who are dealing with patients with onco, like a radiation oncologist, gastroenterologist, neurologists, pediatricians. So the list goes on. So the thing is, they cannot be individualizing, okay, this person has to be a part of my team. My team is me and my therapist. But they handle the patients, they are the primary, like I said, caregivers. And then when the patient comes to you, you are a part of their team. I think that works much better. For example, if there is a radiation onco and you bring up a protocol saying that every patient with head and neck onco before going for radiation meets you once and goes, that kind of holds a lot of impact on the patient as well as helps in the recovery or rehabilitation. Same goes with neuro, same to an extent with the gastros. So I think there is a core team and then there is a general bigger team of your other colleagues.
Agree. So otorhinolaryngologist or laryngologist and speech and swallowing specialist form the core team, and all the other people become as and when they become a part of your team.
A nutritionist is someone I would like to add here.
Yeah, right. So this or that, what are the things you will require in your setup? You tell me one thing, either, so we discussed about fees, we discussed about VFS, we are going to talk about TNE, so what is it, the thing you will want in your team? Yeah.
If it's a question between endoscope versus video fluoroscopy, yes, I would go for an endoscope, no question. But then if I can have both, it's always better. But then if one, then an endoscope, certainly.
Farha?
I have to agree with him. Though I prefer VFS over fees many a times. But I think because most of us have a flexible laryngoscope now, or most of the setups have at least a flexibronch if they don't have a laryngoscope. So that is definitely a part of your equipment.
Okay, so if you're an ENT and you want to start your deglutology practice, you can always start with your scope and you can do fees, and if and when required VFSS, you can refer the patient and then call them back to you. So these are the two most important things which form a part of your dysphagia practice. And then we have TNE, of course, which is an extended part of dysphagia. पैसा बोलता है, so what would be the cost and how much, what is your ROI? So this is the most important thing when it comes to setting up a practice.
5 years.
Okay.
The short answer. When you invest in a scope and the swallowing workstation as it is, I think initially, of course, you won't get patients till the point that your neurology, oncology colleagues know that yes, a specialty like this has developed and probably they are going to get benefited from it. So your return on investment is roughly 5 years. Financial considerations are something that you have to work out at the very outset.
Right. So if you already have with your ENT practice, you have a scope, then you don't have to invest much. But yes, the return is going to take some time because it's not very easy for to convince the neurologist, the oncologist, or the radiation oncologist to send you the patients. So if they send you one patient, then they see the result and then they start doing what is required. So finally, team should be in place, finances should be in place, your goals, what you are really expecting from the practice. Anything else?
From the way I see it, dysphagia practice is a sort of evolving practice. Evolving means not for the ENT colleagues or ENT. It takes some time for you to evolve and try to get specialized into dysphagia and just do exclusive dysphagia practice. So a fair amount of patience is required. So that is something which probably,
Right, you need a lot of patience. Definitely, you need patience and you need training. Yes, you have to invest a lot in trainings and attending workshops. So, yes, sorry, and it's done.
So,
You have set you up for dysphagia clinic. Thank you.
thank you, ma'am.